More than 70 hospitals and nursing homes have asked for help with staffing, and Georgia responded, spending more than $53 million by mid-July in order to do it. But it's not sustainable, not financially and not emotionally.
My name is Dr. Jennifer Barbary. I'm a pulmonary critical care doctor. This is what I put on when I go in a COVID patient's room. I take my white coat off and my head is covered with a bonnet and my face is covered with this, but I try to compensate that by making eye contact and touching the patient and letting them know who I am. It's hard to talk in one of these, so I found my voice getting hoarse. I've always felt called to this profession, but it comes with a heavier burden each time you walk through the doors now.
When you say burden, what are you feeling?
There's this uncertainty about when will this end. There's days where I walk in that I just don't want to put on my mask. I don't want to do it anymore. But then I get an encouraging text from a nurse that I work with, or a sweet note from my daughters or my husband. My husband has really had to pick up and do more than his share. We are definitely a good team. I'm told that our numbers are going down a little bit.
Does it feel that way?
It does not feel that way, no. To hear patients say in desperation, I just want to go home and be with my family, it's hard. We had a 83-year-old gentleman, after being in the hospital for 6 weeks, survived to leave the hospital. Yay! One of the nice things for me that day was to be able to get to see his family for the first time face to face, and to put a name with the face, people that I had been talking to.
This is a moment of celebration and happiness, and yet still clearly very emotional for you. Why?
I think a lot of it is the victories seem fewer in my field than the patients I'm seeing. They're the sickest of the sick. Death can sometimes be overwhelming. Last week I had a gentleman that I had to have a tough conversation with about going on the ventilator, and he asked me to pray with him before we put him on the ventilator. And he passed away a couple of days ago. So knowing that was the last words he heard, just makes me thankful that I got to be a part of that. I hope that this doesn't continue for too much longer, because I don't think it is sustainable. I think there's going to be a high degree of burnout for physicians and healthcare workers. I encourage everybody to wear a mask. If you can do something to protect somebody else, it's a small gesture. I see it as a gesture of kindness for your neighbor.
Redmond Regional and Floyd Medical Centers, where Dr. Barbary works, have treated more than 3,400 people for COVID. The number of cases took off in July, as it did statewide. What we now know is that 3 days after we all got together to start celebrating the 4th of July, contact tracers discovered the highest onset of COVID cases in our community to date. That's why Dr. Barbary says she's concerned about what will happen after Labor Day.